Welcome back to MUF, Minutes Until Fit. This is your host, Imani. Our mission here on this channel is to bring awareness, give motivation, encouragement, and inspire all our viewers to the best possible way. We aim to bring comfort to your mind, body, and soul. We discuss areas of importance of many ailments that many of you are suffering from, or you have loved ones with it, or maybe you just want more information on them. However, the information contained in this video is of general nature and does not constitute medical advice. Talk to your doctor for your individual circumstances. This week, we will cover autism spectrum disorder, video number 3. Don't forget to hit the like button and subscribe to my channel at the end of the video. This week, the topic will cover the medications for autism, the treatments for autism, and that's it. We're going to just do the medications and the treatments for autism. There's no quick fix for autism spectrum disorder. There is no magic potion to make all the symptoms go away or get better. Some medicines treat the core symptoms of autism spectrum disorder. Medications to help relieve irritability often improve sociability while reducing tantrums, aggressive outbursts, and self-injurious behaviors. Medication options may soon change due to researchers. They began testing compounds that may help normalize crucial brain functions involved in autism. We have to wait at least a few more years before we know if any of these drug studies will produce enough information on safety and effectiveness to get the FDA's approval for the treatment of core symptoms. Most medicines that are prescribed for autism symptoms are used off-label, meaning that their FDA approval is for other, sometimes related conditions, such as attention deficit hyperactive disorder, sleep disturbances, or depression. Such off-label use is common in all areas of medication. It's been proven difficult to predict which medications may produce the greatest benefit for a given patient with autism. There's no combination of medications that will work for every person, and all medicines have side effects. Now we will go over some common drugs that are used to treat autism. ABILIFY, ARIPIPRAZOLE, is an antipsychotic drug used to treat serious mental disorders such as paranoia. It is also used to treat people with behavior problems like aggression and severe temper tantrums in people with autism spectrum disorder. RISPERDAL, or RISPERIDONE, is an atypical antipsychotic. It's the first drug approved for children with autism and most widely used. It improves explosive and aggressive behaviors. Drugs can be used to reduce behavior problems like aggression or self-injury in autism, or to treat aggression and irritability in dementia patients. The FDA has approved it for that use. EFFEXOR, VENLAFAXINE, is an antidepressant used to treat autism and showed reduction in behavior problems, irritability, hyperactive, non-compliance in patients with autism. GEODON, an atypical antipsychotic used to treat schizophrenia and bipolar disorder. This medication can decrease hallucinations and help you think more clearly and positively about yourself, feel less agitated, and take a more active part in life. MEMANTINE, that helps with controlling symptoms of irritability and hyperactivity. Memantine and NITROSYNAPSIN is a drug that's been used to treat dementia and Alzheimer's disease, seen as a possible autism treatment because it lowers the activity of so-called NMDA receptors. These receptors respond to the chemical messengers glutamate and mediate excitatory brain signals. Paliperidone is a derivative of risperidone. It has been approved by the FDA to treat schizophrenia and schizoaffective disorder. Paliperidone is used to treat irritability in autism. Antipsychotic meds affects the brain of the person taking them. Selective serotonin reuptake inhibitors that treats the problem that result from imbalances in body chemical systems. Prozac, fluoxetine, Zoloft, sertraline, fluoxamine, usually used for treatment of anxiety, depression, or obsessive compulsive disorder treatment. With these medications can be associated with decreased frequency of repetitive, ritualistic behavior, can improve eye contact, decrease anxiety, irritability, tantrums, and aggressive behavior. It can improve social contacts in autism, and it has an increased risk for suicidal thoughts in children and adolescents up to age 25. Medications that may be used to treat severe behavior problems. Typical antipsychotics like Haldol, thiazide, fluphenazine, chlorpromazine, that decreases emotional outbursts and anger. ZYPREXA and ZIPRASIDONE, off-label treatments of aggression and other serious behavioral disturbances in children with autism. For children that suffer from seizures, there are several anticonvulsants that can be used like carbamazepine, lamotrigine, topiramate, valproic acid. Careful blood monitoring are required with these medications. Seizures are attacks or jerking or staring and seeming frozen. Ritalin have also been prescribed for children with autism. These medications may decrease impulsivity and hyperactivity in some children. Several other medications have been used to treat autism symptoms, like antidepressants, naltrexone, lithium, and some benzodiazepines, like diazepam and lorazepam. They help relieve anxiety and panic disorders in patients with autism. Clonidine is effective in reducing sleep irritation and night awakening to a less degree in improving attention deficit hyperactivity, most instability and aggressiveness in children with autism. Bumetanide, a diuretic used to treat hypertension and swelling, has been shown to help with treating autism symptoms. Upon use, it showed a modest improvement in scores for symptom severity. Using this drug showed a decrease in repetitive behavior, decrease of loss of interest in objects. These reductions in unsociable behavior allow more time for increases in social behavior. Stimulants can help increase focus, decrease hyperactivity in people with autism. Really helpful for those with mild autism symptoms. Treatments. Autism treatments are rarely medical, but instead include intensive behavioral developmental, speech and occupational therapy. Types of therapies, types of treatments, behavior and communication approaches, dietary approaches, medication, complementary and alternative medication. Applied behavior analysis encourages positive behaviors and discourages negative behaviors to improve a variety of skills. The child's progress is tracked and measured. The ABA helps teach social, motor, and verbal behaviors as well as reasoning skills and works to manage challenging behavior. They would need to do 20 to 40 hours a week of intensive therapy, and this type of treatment is very expensive. And there are different types of applied behavior analysis. Discrete trial training. Series of trials to teach each step of a desired behavior or response. Lessons are broken down into their simplest parts, and positive reinforcement is used to reward correct answers and behaviors. Incorrect answers are ignored. Early intensive behavior intervention. Children are usually younger than 5 years old, and the teaching approach is to build positive behaviors such as social communication and reduce unwanted behaviors like tantrums, aggression, self-injury. Takes place in a one-on-one adult-to-child environment under the supervision of a trained professional. Early Start Denver model. Children with autism between the ages of 12 to 48 months. Parents and therapists use play and joint activities to help children advance their social, language, and cognitive skills. Pivotal response treatment aims to increase a child's motivation to learn, monitor their own behavior, and initiate communication with others. Positive changes in these behaviors are believed to have widespread effects on others' behaviors. Verbal behavior intervention, and that focuses on teaching verbal skills. Social skills class can be one-on-one or in a group. Instruction at home, in school, or in a community. The aim is to improve how children interact socially and form bonds with each other. This usually means through role-playing or practice. Class is led by a therapist, but parent training is the key to helping a child improve his social skills. Therapeutic horseback riding is called hippotherapy. A child rides a horse under the guidance of a therapist. Riding is a form of physical therapy because the rider needs to react and adjust to the movements of the animal. Research shows it helps children from ages 5 to 16 improve their social and speaking skills. Can also help them to be less irritable and hyperactive. Picture exchange communication system. This form of therapy teaches children to trade pictures for items or activities. This system is designed for those who don't speak, can't understand, or are difficult to understand. Floor time. Common play therapy method in which a teacher or therapist gets down on the floor to play with your child on his terms. You join in by playing the same way that your child is playing. Then you add something new to the game. The goal is to create play that goes back and forth between you and your child to encourage increased communication and add new aspects to his play. It should help them grow emotionally and learn how to better focus his thinking. Floor time therapy for 25 hours a week for 2 years or longer improve all areas of development. Integrated play groups. This group combines children with and without autism spectrum disorder. So those with autism can learn how to play while they follow their peers' lead. They may pretend play more over time, and they'll have many chances to improve their social skills while they spend time with their peers. Research has shown that children with autism who attend 2 30-minute integrated play group sessions per week for 4 months improve their quality of play, used their toys in a more typical fashion, and showed improved social interaction with their peers. Joint attention symbolic play engagement and regulation. This method can help your child improve their joint attention skills, meaning they can focus on a toy and a person at the same time. It can improve the way they play with others. The program can also help your child engage in more pretend play, expand the way he plays with toys, speak more with others, and improve their other social skills. Therapy for up to 25 hours per week. You may notice that your child gains new skills within just a few weeks. Either he's talking more while he plays, he's driving cars down a ramp instead of just spinning the wheels, or making other progress. Relationship development intervention. RDI aims to teach children how to think flexibly and engage in social relationships with other people. This therapy usually begins by helping children develop relationships with their parents and other family members. This therapy focuses on the disorder's core deficit, social skills, and interactions. Parents' involvement is key to its success. Parents must devote time to workshops or watching videos to learn how to give your child an effective intervention program. Therapy could be time-consuming and expensive. Sensory integration and related therapies. Many children with autism have sensory problems. Some are overly sensitive to stimuli such as lights, noises, and touch. Others are not sensitive enough. Therapists skilled in conducting sensory therapy for autism work one-on-one with a child. The goal is to help regulate the child's reaction to extended stimuli. The therapist makes the activities enjoyable and game-like for the children. They're not forced to do anything, but the therapist pushes his boundaries to help them improve. Occupational therapy. Role in treating autism. Occupational therapists study human growth and development and a person's interaction with the environment through daily activities. They are experts in the social, emotional, and physiological effects of illnesses and other developmental disorders. Occupational therapists can help in two main ways: evaluation and therapy. They will sometimes videotape the child during the day in order to see how the child interacts with his or her environment so they can better assess the kind of care the child needs. They are observing for attention span and stamina, transition to new activities, play skills, need for personal space, responses to touch or other types of stimuli, motor skills such as posture, balance, and manipulation of small objects, aggression or other types of behaviors, interactions between the child and caregivers. Occupational therapy, how it helps with autism. Therapy is tailored to each person's needs. The therapist will develop strategies appropriate for each person's therapy, like physical activities such as stringing beads or doing puzzles to help a child develop coordination and body awareness, play activities to help with interaction and communication, developmental activities such as brushing teeth and combing hair, adaptive strategies including coping with transitions. The overall goal of occupational therapists is to help the person with autism improve his or her quality of life at home and in school. The therapist helps to introduce, maintain, and improve skills so that people with autism can be as independent as possible. Occupational therapist helps foster skills like daily living skills such as toilet training, dressing, fine motor skills required for holding objects while handwriting or cutting with scissors, gross motor skills used for walking, climbing stairs, or riding a bike, sitting, posture, or perceptual skills such as telling the differences between colors, shapes, and sizes, awareness of his or her body and its relation to others, visual skills for reading and writing, play, coping, self-help, problem solving, communication, and social skills. By working on these skills during occupational therapy, a child with autism may be able to develop peer and adult relationships, learn how to focus on tasks, learn how to delay gratification, express feelings in more appropriate ways, engage in play with peers, learn how to self-regulate. 8 out of 10 children with autism having problems processing sensory input. They can't seem to filter out background noise. Other signs of processing issues: problems with balance, problems with body position in space, oversensitivity to touch and to feel of certain types of clothing such as socks with seams. Social, behavior, and attention problems can be partly a result of these sensory challenges. You can obtain occupational therapy services either privately through a statewide early childhood intervention program or at school. Public law requires schools to provide certain types of occupational therapy to those who need it. Private insurance and Medicaid may pay for occupational therapy services. Dietary approaches. Some biomedical interventions call for changes in diet. These changes can include removing certain foods from a child's diet and using vitamins and mineral supplements. Dietary treatments are based on the idea that food allergies or lack of vitamins and minerals cause symptoms of autism. Some parents feel that dietary changes make a difference in how their child acts or feels. If you are thinking of changing your child's diet, please talk to your doctor first or a registered dietitian to be sure your child's diet includes the necessary vitamins and minerals for their growth and development. Thank you for tuning in once again. This has been your host, Imani. Please feel free to comment or email, suggest a topic, just to say hi, whatever. I'm always here to help. I'm always a listening ear. And don't forget to hit the like and subscribe button at the end of the video. Until next time, peace.